the importance of microminerals in sheep and goat nutrition. The copper, it is having important role in cellular respiration, bone formation, connective tissue development, and it is essential for as a catalytic cofactor of some metalloenzymes. The role of copper, it is an essential component of range of enzymes required for normal body functions, that is cell energy metabolism, signaling the nervous system. So if there is an excess of copper, then it will be stored in the liver, and liver can store up to some extent. But beyond that, if the storage level is increased, then excess will be released to the bloodstream. And once the copper is releasing to the blood, then their destructions of RBC starts, will damage the liver, and ultimately death can be seen. The symptoms, the major symptom of this is the swayback. Swayback is the major symptom of this deficiency in newborn lambs. These are the pictures which are showing this swayback. This occurs when a ewe experiences a dietary deficiency of copper during mid-pregnancy, resulting in the lesions to the developing lambs in the spinal cord, or the damage to the spinal cord and cerebrum. And the lambs are stillborn or weak, and this is seen characteristically in hind leg weakness. You can see the spectacle eye. So this is spectacle eye. This is one of the symptoms of this deficiency. Poor growth rate, scoring, and poor fleece quality, that is called steely wool. You can see the steely wool is another symptom. So the toxicity is very common in sheep, and sheep are very highly sensitive compared to goats. Okay, certain breeds like Texel are more susceptible. Sheep are highly sensitive as per the Meshi 2000, and goats are tolerant to some extent compared to sheep. Copper levels required in the body. Copper requirements for goats is 8 to 10 milligrams per kg. And copper requirements of sheep is 7 to 11 milligrams per kg of dry matter. Deficiency symptoms are seen if the blood level of copper is less than 14 micromoles per liter. Severe deficiency can be seen if the level is reduced less than 6 micromoles per liter. And recommended copper level is 10 milligrams, and the toxicity is up to 17 to 18 milligrams per kg dry matter. And the symptoms of toxicity is seen once it crosses 25 milligrams per kg of dry matter. Copper deficiency can occur due to many factors. First is soil, the level of copper in the soil or pasture, and even the level of molybdenum and sulfur also affects the copper. If in the presence of sulfur and high level of molybdenum, copper is not available for absorption. That is called thiomolybdate. This structure, which is formed in combination with copper, molybdenum, and sulfur, is called thiomolybdate. With the formation of this thiomolybdate, copper will not be available for absorption in the body. So the molybdenum level should be taken care. Iron can also play a role. Even if the iron level is more, copper will reduce. So iron is having another antagonistic effect. Excessive liming, the pH if increases, it will increase the molybdenum. So once the molybdenum is increased, the copper level decreases. So molybdenum should be optimum. It should not be more in the diet also, in the soil also. And pH should be maintained in the soil also. Liming, lime we should not apply in the soil more. So to increase the molybdenum, you cannot apply more lime. The role of copper in the reproduction. Low copper content in the sheep, it is having a role in the reproduction. So it causes embryo loss, inhibits embryo implantation and fetal death. Although it is showing the copper has a role in even in immunity also, but the threshold level is very less. Only 18 up to 18 milligrams you can feed. More than that you cannot supplement. So beyond that, it leads to toxicity. So the deficiency has shown that some of the research reported that from 148 aborted Eves found that the abortions, it causes abortions if the level is low, with the low copper concentration. Anke, they have observed that the goats with copper deficient diets has shown low conception rate. 50% gestating goats with copper deficiency resulted in abortion, mummified fetus, hemorrhagic placentas, necrotic lesions. In sheep, the postnatal lordosis, detected as muscle weakness and ataxia, is also caused by copper deficiency during gestation. When goats are exposed to prolonged period of copper deficiency, it may also lead to nymphomaniac reproductive behavior. So continuous, if the animals will be, female animals will be in heat, even in males also. The blood copper levels are not directly related with the reproductive behavior. Okay, sometimes the blood level shows normal, but behaviors will be different. So blood is not an ideal way of diagnosing. Blood sample is not an ideal way of diagnosing for copper deficiency or toxicity. Either deficiency of copper, excess of molybdenum or sulfur leads to reproductive disorders in sheep and goat. The sources of copper. Cereals and concentrate feeds are rich in copper. Distillery grains, dried distillers grains, brewers distiller grains are rich in copper. When you are feeding or supplementing this distiller grain, you must be cautious. You must be aware of this, the copper. It's rich in copper. You just check the level of copper, estimate the copper in the supplements, and then you restrict the percentage of inclusion in the diet. And the molasses sugar beet is rich in copper. Pig manure is rich in copper. If you use a pig manure for the cultivation of forages, then you must be aware that pig manure is rich in copper. Diagnosis of copper deficiency. First is dose response. You give a dose of copper. If it is recovering, then is well and good. Then another way is analysis of liver tissue in dead or slaughtered stock. This is blood sample analysis. If the plasma level is below 9.4 micromoles per liter, it indicates the depleting reserves of copper in the liver. However, the lamb performance is not adversely affected until the level is less than 3 micromoles per liter. Supplementation of copper. The prevention of copper deficiency is much more important than treatment, because there is no treatment for the sway back. That is why prevention is better. Copper can be supplemented through feed ration or mineral blocks. However, toxicity must be considered. So long-term cover can provide a copper heptonate injections, or more commonly orally using gelatin capsule, that is copper oxide, in mid-pregnancy. It has shown a good result.